Straightening of the lumbar spine, it's also known as flat back syndrome. I've been getting a lot of questions about straightening of the lumbar spine, particularly what it is and what can be done about it in terms of treatment. So in this video, I'm going to answer a question that I got from one of my viewers in one of my comments about straightening of the lumbar spine. Straightening of the lumbar spine is a serious condition. So if you've been diagnosed with that, this is an important video for you to watch. Be sure you watch right to the end because I'm going to show you two non-surgical, non-operative treatment approaches that we use in our office and as well with patients when they're diagnosed with straightening of the lumbar spine. As well, I'm going to give you some steps to help guide you in the right direction if you're looking for non-surgical, non-operative methods to help with it. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. Welcome to my channel. This channel is all about helping you relieve pain and correcting your spine without surgery so you can get back to living your best life again. So if you like this video and you like the content on this channel, be sure to subscribe by clicking on that red button below, tap on the notification bell, turn on the YouTube notifications on your mobile devices so you don't miss out on these great new video contents that I put out on a weekly basis. A while back ago, I uploaded a video on my channel. It's called Lumbar Spine Straightening. I'll put in the description below. And since I uploaded that video, I've been getting many questions about this and what can be done about it, which tells me that a lot of people out there that may be diagnosed with lumbar spine straightening are actually looking for non-surgical solutions, which I want to offer you some in this video. But here's what she just said. She said, "Hi doctor, I have straightening of lumbar spine from years with back pain as well. And my doctor told me that it's due to muscle spasm. May I know the possible causes and treatment options?" End quote. And that's what I want to talk to you about in this video. First of all, what does lumbar spine straightening even mean and what does it look like on a spine model? Well, first of all, we need to know what normal is. So here's Mike the Spine. Mike the Spine makes an appearance on my videos now. And normally, from the side view, the lumbar part of the spine is the lower part, right? It normally has an actual elliptical shape. So the lumbar spine from the side is curved and the curve approximates the shape of an ellipse, which is totally normal. When that curving of the elliptical shape of the spine is reduced, lost, or reversed, that's part of a flat back syndrome. It's also associated with a forward shifting of the rib cage or thoracic area. And what it looks like on another model here, so here's another model, you see the spine is completely straight. So that's straight spine, okay, or flat back. It should be curving like this. But when it's flattened or straight, that's now diagnosed as a straight back syndrome, and it's very serious. So to dive into this a bit more, to tell you about what can cause straightening of the lumbar spine or flat back syndrome, I'm going to share with you some of the excerpts from this study right here, this research study right here. And this has been done by Dr. Dee Harrison and Dr. Paul Oakley, and it's called Non-operative Correction of Flat Back Syndrome Using Lumbar Extension Traction, a CBP case series of 2. And I'll put a link to this study in the description below. And what the study showed was that they had 2 patients with diagnosis of flat back syndrome, which is a straightening of the lumbar spine, right? Straightening of the lumbar spine, and they both presented with low back pain. And what they showed was that there was an actual successful correction of that straightening of the lumbar spine into a more curving position. Now, why is that significant that there was a correction? Because that was a non-operative, non-surgical correction. You see, I truly believe that surgery should be the last option unless it's urgent or emergency or there's significant neurologic compromise going on. Surgery is always available. It's always on the table as an option. So the key is that most people want to avoid spinal surgery. There's a lot of risks involved with it, especially when it can be pushed down if it's not absolutely necessary as an emergency. So most people want some form of non-surgical corrective approach. And chiropractic care and corrective chiropractic care, such as CBP, which stands for Chiropractic BioPhysics, as it was demonstrated in the study, is one of those non-surgical, non-operative approaches. So what causes flat back syndrome? What causes straightening of the lumbar spine? Well, there's 7 different causes that were mentioned in this research case study over here. One of them can be iatrogenic, which means it's induced by some type of treatment or therapy that was done by a therapist or doctor. Number 2, degenerative or postural. Number 3, hip flexion contractions or contractures. That means tight hip flexor muscles, which pulls from the front part of the spine inside the abdomen and, of course, flattens out the lumbar curve. Number 4, fixed thoracic hyperkyphosis or thoracolumbar kyphosis. So again, some spinal displacements that can contribute to that. Number 5, hormonal changes. So it's physiological and internal and hormonal. Number 6, traumatically induced fractures. And number 7, insidious onset, which means that it just kind of happened over time and there's really no known cause of why it happened. Now, in this case report, Dr. Harrison, Dr. Oakley also mentioned that there's 2 categories of flat back syndrome. One's a more fixed category and one's flexible. Now, the fixed version actually does require some type of surgical approach, but the flexible version can be actually managed with structural rehabilitation type protocols, which I'll show you later on in this video. So in this case report, what Dr. Harrison, Dr. Oakley found was that both of the patients that they saw had an improvement in their lumbar lordosis, and as well as a reduction in their pain and an improvement in their posture. So what they showed was one patient had a 50 degrees lordosis improvement in 100 treatments over 20 weeks, and the other patient had a 26 degrees lordosis improvement in 70 treatments over 16 and a half weeks. As well, like I said, their pain decreased and their postural balance improved, and as well other structural measurements they checked on their x-rays also changed. Of course, you have to understand that this type of structural rehabilitation work takes time and effort. It takes time and a lot of intervention in terms of corrective methods to take a spine from a straight position and a poor postural position into a more improved curving position. And the best part of it is that it was done non-surgically, non-operatively, which is key, which is what most people want. Now keep watching, because in a moment, I'm going to take you into my traction room just around the corner here and show you 2 ways that we help structurally rehabilitate a straightened lumbar spine. So these are the treatment options that we offer now. And one of the things we do is in-office sagittal alignment, traction, and as well we have a home version of that traction that we can send people home to. I'm going to demonstrate both of those today. Before I do that, I want to show you a little deeper why it's important to have a healthy spine when it's out of position. Not only can it cause spinal degeneration, disc bulge, nerve irritation, pain, inflammation, maybe even radiating pain down the legs. I had a patient once that had a massive disc bulge condition with leg pain, and I took an x-ray of his spine. He had a complete straining of the lumbar spine. So he was a candidate for this type of treatment I'm going to show you in a moment. But I want you to follow this. Watch this. Here's my nerve chart, which I'm going to start showing on all my videos from now on. You'll see here a normal lumbar curve, right? Normal lumbar, right there, normal lumbar curve. The implications of a structural misalignment of the spine is not just degeneration and pain, like I said, but if it irritates the nerves, these nerves here in the lumbar area and the sacral region, they go to the lower digestive system, like the colon. And they also go to the bladder, so the pelvic organs, the bladder, the sex organs, kidneys. So any irritation, interference from bones on these nerves that are out of alignment, irritating the nerves, can affect the health of your organ systems as well. Remember, an optimal spine equals optimal health. Optimal spine equals optimal health. The brain controls everything in your body, right? There's 31 pairs of nerves that come out from the spinal column. On the inside of the spinal column is the spinal cord, which connects your brain to your entire body. So you need an optimal spine. If it's shifted out of position, if it's distorted, displaced, or misaligned, it can irritate the nervous system, and then your organ systems don't function well, which is why we see a high correlation of other health conditions when someone comes in with either poor posture or bad spinal alignment. And that's what you owe to yourself, to find a corrective care chiropractor that can work with this, if you have this, to bring it back to a better position. So at the end of this video, the very end, make sure you watch the end. I'll give you some steps that you can do, and I'll also show you how you can find a corrective care chiropractor as well. So welcome to my traction room. I'm using a Deneral table traction system, and what I have here is Mike the spine. He's lying down on the table. So let's say this was my patient that had a straight lumbar spine. I would do a 3-point bending traction, similar to the one done by Dr. Harrison and Dr. Oakley in the case study that I just talked to you about. So the patient would be lying down on their back, facing up. So I don't have a patient with me right now, but I'll use the spine, which is pretty cool because you get to see what the spine's doing in this model as I'm doing the 3-point bending and extension traction of the spine. So a straining of the lumbar spine means that there's a loss of that normal lordosis. So what we want to do is we want to improve lordosis by extending the spine. So it's called extension traction. So the goal of this type of extension traction is to take the spine, which is straight, right? Straighten lumbar spine, apply 3-point bending, hold the body down to top, hold the body down to pelvis or legs, and then pull and traction it to get a bending curve in there. So what it would look like over here is I use this broad strap, which is comfortable under the person's lower back region. I have a pulley system here, and I can actually begin to increase. You see how, as I'm pulling down, how the lumbar spines begin to actually curve, and then place it lock it in place and leave it in a position that's comfortable for the patient. And we start with 3 minutes. Every day increase 1 minute until we get to 15 minutes or even up to 20 minutes. Exact same protocol as in the case study that I talked about earlier. And what it does is it helps to create creep deformation in the ligaments, help to reshape that spine into a better curvy position. Now, that's our in-office lumbar extension protocol. If you can imagine that the patient will need multiple dosage time to make a difference. So that means doing it on a regular basis every day, 20 minutes at a time, and the more, the better. So if they're coming to our office maybe 3 or 4 times a week, well, what about the other 3 or 4 days? So we send people home with a roll like this. This is called a Dental. This one in particular is a lumbar Dental. And now the patients can do a similar traction, not as intense because they're not using pulleys at home and 3-point bending, but a similar traction to help get that creep deformation of those ligaments and keep that correction going on the days they're not in our office. So we provide also this for our patients for this type of particular condition to work that straightening lumbar spine. So I'll show you what this looks like. I'll get on it myself and you see exactly what it looks like as well. So let me show you first on Mike the Spine what this lumbar dental does. Again, if there's a straightening of the lumbar spine, lying on that would help to, of course, your body weight goes down, would help to reform that into that nice elliptical shape. In some cases, we place it like this. In some cases, we place it like this, depending on what we need to accomplish with that lower lumbar spine area and the pelvic tilting and sacral tilting as well. So let me get on this so you see what it looks like on a real person. So the best way to get on this is by first lying flat on the ground and then bridging up, placing it at the prescribed area and then dropping down. You see how my body begins to bend over it. And that's tractioning that lumbar spine into extension, helping to reduce that straightening lumbar spine. If it needs to be done the other way, depending on the x-ray and scenario, again, same effect, just a little bit tweaking it differently. Getting out of it. What does it feel like? Well, this is a firm foam, so it is a bit uncomfortable, especially if someone has pain, but it's not going to harm or cause any injury. And at some point, the patient will get used to it. So we build up the time with 1 to 2 to 3 minutes at the beginning. Every day, increase of 1 minute at a time until they get to 15 to 20 minutes. And eventually, patients tell us that they begin to find it comfortable. One more important thing I need to say about traction, such as this extension traction, is that we have inclusion criteria for patients to qualify for this type of care. And there's also exclusion criteria. So it may not be suitable for all people. So what's required is a thorough examination, thorough consultation, case review, perhaps MRI report review, X-ray analysis for sure, and make sure there's no contraindications in there. For instance, if someone had a forward slipping of a vertebra, such as an anterior listhesis, this is not indicated. Extension traction is not indicated because it makes that condition worse. So we need to see what the indications are and contraindications are. So what did you think about those traction setups? Comment below, let me know what your thoughts are. I want to leave you with these 3 steps. Number 1, if you've lost hope, regardless of whatever your health condition is or spinal condition is, I want you to know not to give up, don't lose hope. Number 2, your body does have a natural ability to heal. It sometimes needs some type of support. It needs some extra things done to it. And one of those things can be 3, chiropractic care. Look for a chiropractor in your area. It can be a corrective care chiropractor. It can be a chiropractor of any kind. But if you're looking for structural rehabilitation of the spine, you need to look for a corrective care chiropractor, one trained in chiropractic BioPhysics, such as myself. If you need help finding a corrective care chiropractor in your area, comment below, ask me, let me know, and I'll help direct you to a directory of chiropractic BioPhysics doctors, corrective care doctors around the world, most in the United States and Canada, some in Europe and England, some in Australia and New Zealand. So I'll do my best to direct you to one of those places. As well, continue the actual viewing experience on my channel. go watch this video right here, which is more information about straightening of the lumbar spine. And then check out the other videos in the description below. If you have conditions like disc bulges, I have tons of videos about exercises.